price to do the work they need to do. They're under Jerem's direct guidance and supervision. Then next to Jerem is Miss Tina James Tafoya. And, hi, how are you? And Dr. Biden, she is our Chief Administrative Officer, and she hates it when people say this, but she also is a former Miss Navajo. So I had to get that in there, Tina. But Tina also is the division chief over all of those other teams. Nutritive services, like I said, the teams that are underneath us are crowds. But one of the roles that Tina played in, and she's very modest about this, at one point our emergency department contacted our CEO and said, we're out of gowns. And if we don't get gowns, if we don't do something, we're not going to be able to do what we need to do. So under Tina's great leadership and Dr. Atkins' guidance and her idea, they put together a sewing strike force team. And we sewed how many gowns, Tina?
Wow, over 6,000.
6,000?
Yes. We did our own gowns. Yeah.
Wow. We did gowns, caps, face masks, even booties for the clinicians.
And without their great efforts, and these were just staff members that knew how to sew. They brought their own machines, and
You're my hero.
it was amazing. It was amazing. And all four of these individuals just went over and above just to make sure that our community is safe.
Thank you.
Okay, ma'am, if you don't mind, I'd like to walk on. We've got some really great frontline workers over on the other side here.
All stay back behind the curtain, okay? Stay behind the curtain.
The resiliency members who were very interested in getting their vaccines. We have one of the highest vaccination rates in the entire, compared to like the national level. Our level is higher. And so when we finally had the vaccines ready, our community members jumped in and they got the vaccine. So this group of people, these folks are pivotal. They comprise nurses, finance team members that kept us afloat financially. Without their efforts, we would not be here. Our EBS, our housekeeping staff that were in the rooms cleaning after our COVID patients. Respiratory therapy is here. They were bedside with our patients, taking care of them, and they kept our folks alive as well. We have our facilities maintenance, these two gentlemen here. They built all of the barriers, did anti-rooms. They took care of all that. They've moved this poor shack around the building about 8 different times. So
We've used it for all kinds of things.
Right. So without these folks, we would not be here. Our patients wouldn't have been as healthy. They have taken care of everything.
Thank you. Thank you. That's the goal, right? Everybody got it.
And during our vaccine efforts, these folks were directing traffic. They were helping people park. They were watching people after they got the shot to make sure they didn't have a reaction. So whatever their regular jobs were, they helped and did the vaccine events as well on top of it.
So your president, well, your president, but the United States president says thank you, President Biden. And I'm sure President Pez will say thank you
Well,
too.
you guys did an outstanding job and still are doing that. I was shoulder to shoulder with each and every one of you. I wasn't cooped up in an office or anything, right here trying to get people to come. And I just want to say on behalf of the Navajo people how proud we are of you all. The warriors, these are the warriors on the front lines throughout this whole pandemic. And we appreciate it. Give you
Yes, ma'am. So really, these people kept people alive, kept them from getting sick, or kept them really from passing. They did great work. And President, I appreciate those days that you were out here at our vaccine events. You and I saw each other each and every time, whether it was 9 degrees or not.
Social media brought a lot of the people in. We were doing live segments, telling everybody,
Yeah.
the line is thin, come on over,
Yes.
and people were coming.
Yeah, and that was the great way to reach people. As soon as his voice was out there saying, "Come on, they have 500 doses left. Come on down." People came, and that's how we've gotten to the point of vaccination that we are right now. And I believe we are 100,000, 90,000 people on the Navajo Nation that have received vaccines. Our organization alone, we have given close to 20,000 doses, just our organization. So it's a testament to people being willing to try to protect our elders. We knew that the people that were going to get hit the hardest were our elderly. They were not going to survive this. But what we could do to protect them, we could all get vaccinated. We could make sure our brothers, our sisters, our husbands and wives, we all got vaccinated so that we could protect our elders. And everybody stepped up and did their part.
Now, do you have a community outreach program that goes out into the, like far away and
Yes, ma'am.
remote areas?
We have mobile units. They're both out in the community today, so unfortunately you can't see them. But now that we're able to get out and see people again face to face, so they will go out and do blood pressure checks. While they're there, they take bottles of the vaccine with them. So if somebody comes up and says, "Hey, I never got my vaccine," great, we'll give it to you today. Yeah, so that's probably going to be our next phase of getting those last little stragglers, is going out in the communities with these big mobile units and taking care of them. And they've been really beneficial, just to reach people out in faraway areas.
And ma'am, I think because we worked so hard there when COVID hit the Navajo Nation,
We talked to President
that I think as a people, we were just, I remember when the first batch of doses arrived, there was it was a tangible ray of hope, just like a sigh of relief that there's hope on the horizon. And I think as a people, we knew that we were going to need to be vaccinated so that we could, everybody knows that I wear the mask for you and you wear the mask for me. Same thing with the vaccine.
Yes.
We get the vaccine to help protect each other. And that was our focus. And as a people, that's what I think we focused on. We just want to make sure we're all safe.
Yep.
So thank you, ma'am.
Well, Dr. Biden, this is just one of many healthcare facilities, 27,000 square miles of Navajo land. They say it's similar to the size of West Virginia. And we have our Navajo Area Indian Health Services Director, Rosalind So. She, by the way, I did write to your husband. I'm asking your husband to nominate her, put her in the position of the Indian Health Service.
I happen to know that.
So I'm going to throw a pitch while we in front of the media right here.
I got briefed on this.
Dr. Jill Jim, as you know, was on the Biden-Harris COVID-19 work group prior to their inauguration. And so this team that you see here and many all across the Navajo Nation have been a big part of the success of getting the vaccines into the arms of our Navajo citizens and keeping that number low. As you know, the other day, we went 10 straight days without any deaths, low numbers. And, I just want to give maybe a minute or two to Rosalind to give you an overview of the IHS facilities, and then Dr. Jim, to give you an overview of the 638 self-governance facility, like TMC here. Similar to the schools, you got to remember the tribal control, the BIA, and then the state schools. Healthcare is almost similar to where we rely on the Indian Health Services, and then we also have self-governance facilities throughout the Navajo Nation. Rosalind?
Thank you, Mr. President, and good morning, Dr. Biden. So yes, there was a lot of coordination that went into this. I mean, the President is not giving himself enough credit with respect to guiding us and leading us, forcing this unified system for us to come together, to pull all the resources, all the people that were required to do this. So in the Navajo area, we have 12 facilities that are still operated by the Indian Health Service and over 4,000 federal employees, and we relied on an additional 2,000 contractors. But during the pandemic, we brought in about 1,000 volunteers
Yes.
to help us meet all the needs and the requirements that we had. So we're pretty excited about the work that we did out here. It was.
You did a great job.
Thank you.
You did a
Thank you
great
very
job.
much.
Well, thank you, President Nez, and also Dr. Biden, and also I'm thankful for serving the time there with the transition team as a COVID-19 a Biden-Harris advisory member, with all the wonderful seasoned individuals that were on that team who we remain connected to this day to address the pandemic that has impacted us not only here, but also globally and across the United States. And I just wanted to share with you that every day, Roseland and many of the healthcare facilities, and every week we still address COVID as a team. It is a very coordinated approach, but it requires lots of leadership support. Honorable Delegate So is here with the HES committee as well to continue to make a dent in our numbers. We've been plateauing for a very long time. We believe the vaccines are working. We've been very vigilant in our restrictions. We require a mask mandate, and we'll continue to do that until the pandemic is over. So we are thankful for all of the citizens here and also the healthcare workers, knowing the importance of keeping the numbers down and the public health orders. And we will be in yellow next week, and it's all because of every single one of us contributing to wearing our masks and getting vaccinated. So I just want to thank you for coming on to the Navajo Nation, but it requires local, state, federal support for all of this to happen.
Working together, right?
We have seen
Working
FEMA
together.
here, we have seen ASPR here, we have seen the Department of Defense, we've seen the VA here, CDC, all of these federal agencies have come here to support us, and it will take a large village to continue to keep the numbers down, and we're just thankful at this point that our numbers are low and continue to be low. So if you have.
Yes, yes. Thank you. And thank you to the frontline workers.